As we know that about 85% of breast cancer occurs in women who have no family history. Therefore, knowing the modifiable factors which increase the risk of developing breast cancer becomes very important for us. Because if we know the factors, we know the first A, that is aware about these factors, we can go to the subsequent A, that is avoid, and the third A, that is assess, and we are more inclined to activate the Brahms protocol. I have already discussed about estrogen, pregnancy, breastfeeding, menopause, nulliparity, obesity, and physical activity. I will now be discussing the other modifiable risk factors, what they are, how they increase our risk of developing breast cancer in detail. Still, if there is any aspect in which you need more clarification, please write in the comment box. I will discuss them subsequently. Now, today I am going to talk about alcohol and smoking. Breast cancer risk increases linearly with the amount of alcohol consumed. Now, linearly means that as the alcohol intake increases, your risk of developing breast cancer increases in a similar manner. More alcohol, more the risk. So, higher the risk of developing breast cancer. There is 20% higher risk for women to develop breast cancer who consume 2 to 3 alcoholic drinks per day compared to non-drinkers. Now, how does alcohol act? How does alcohol increase your risk of having breast cancer? There are multiple mechanisms. Mostly, first is oxidation. That is, it causes production of free radicals. Now, these free radicals or hydrogen ions and other ions, they damage the DNA, proteins and fats, promoting carcinogenesis, that is development of cancer. Then there is the formation of toxins. Now, alcohol gets converted into acetaldehyde, which is a toxic carcinogen. Okay. Now, this again causes production and release production of cancer cells. Okay. Now, it causes an increase in the estrogen levels. Breast cancer risk again increases because of increased estrogen levels, and along with it, it decreases the nutrition component. So, nutrition component decreases, more calories, more obesity, and less of vitamins and minerals. So these are the mechanisms by which alcohol causes an increased risk of developing breast cancer. Studies have also shown an association with smoking causing an increased risk of breast cancer, which gets amplified if you do both, that is, you smoke and drink alcohol. Therefore, it is advised that ideally, if you can avoid alcohol, it's better for you. But if not possible, at least decrease the number of drinks to the minimum possible. That is up to 1 drink per day for women and up to 2 drinks per day for men. Now, these recommendations are for very cold countries. In temperate and tropical climates, preferably it would be a drink once a week or on social occasions. Few of my friends would like to add that there are certain substances in red wine, such as resveratrol, which have anti-cancer properties. However, my dear friends, there is presently no evidence. I'll repeat again, there is no evidence that drinking red wine reduces the risk of cancer. There is no evidence, so please do not think that if you will have red wine, you will be decreasing your chances of getting breast cancer. Please note that a drink is 12 ounces of beer, 5 ounces of wine, or please note that 1 ounce is equal to 30 milliliters. So 12 ounce of beer would be around 350 ml of beer, and 80% proof is equal to 40% alcohol by volume. Now, alcohol by volume is one of the most common proof measurements for spirits. Most rums, tequilas, gins, whiskies, vodkas and cognacs are 80% proof. Therefore, 1.5 ounces of 80% proof distilled spirits would be around 45 ml of rum, tequila, gin, whiskey or vodka. So the next time you pick up your drink, go to two things. Control the quantity and check the proof. Ideally, let it be less than 80% or lower. Okay, so control the amount you are having, plus lesser the proof, better it is for you. That is for alcohol. Now, another important issue which is responsible for increasing the risk of breast cancer is the OCP use. That is, OCP is oral contraceptive pill use. It's a very important issue, and a lot of times my patients ask me this, that does it have a role to play in development of breast cancer? Taking birth control pills increases the risk of developing cancer. Okay, most of the young women working all over the world are using OCPs or hormonal intrauterine devices for contraception. Taking birth control pills increases the risk of developing breast cancer. Oral contraceptives are also known as the pill and are a common form of birth control all over the world. They prevent pregnancy by changing the level of hormones in the body. These are the hormones that control the menstrual cycle, okay, control the periods. There are two main types. The combined pill, that means this pill contains two hormones, estrogen and progesterone. And the other type of pill is also known as a mini pill, the progesterone only pill. This pill only contains the hormone progesterone. Okay, so a lot of studies have examined the use of oral contraceptives as a risk factor for breast cancer, and they have produced conflicting results. Some researchers think this might be due to the fact that the level of hormones in birth control pills has changed since they were first studied. The earlier birth control pills contained very high level of hormones, and compared to today's low dose pills, and they posed a higher risk, and the new ones pose a lesser risk. The Scandinavian researchers have noted an increase in breast cancer in a group of women that were using or had recently taken birth control pills. Now, longer use of the pill seemed to increase the risk. Similar research found that 10 years or more after a woman stopped using birth pills, their breast cancer risk returned to the same level as they had never used birth control pills. However, another reputable study by Women's Contraceptive and Reproductive Experience, that is Women's Care Group, done between 1994 and 1998, showed that there was no increased risk of breast cancer. Repeat, no increased risk of breast cancer in current or former users of birth control pills. So this becomes very conflicting. One study has shown that there is an increased risk, but that study was done during a period when the doses of hormones used in the oral contraceptive pills was very high. But the other study has shown that it does not have any impact. However, there are a few take-home messages. Using combined OCP means both progesterone and estrogen definitely causes an increased risk of breast cancer. So please avoid using a combined OCP. Now this is based on regardless of the progesterone component or monophasic versus extended cycle administration. So all those ladies who are on a combined OCP, please do not use a combined OCP. You can go in for a mini pill that will be safer for you for developing breast cancer. Now, an increased risk was also identified in levonorgestrel, only oral and non-oral products. However, most women who choose to use this method of contraception do not expose themselves to long-term breast cancer risk and may benefit from reduction of other types of cancer later in life. Now, further research is needed to determine the breast cancer risk of non-oral combined contraceptives and non-levonorgestrel progestin only formulations. So there's a lot of issues, but please remember that if you're using an OCP, avoid a combined pill, be cautious, remember to get regular screening mammography, and if possible, you can activate Brahms protocol. Now, another question commonly asked is, does the risk of breast cancer associated with OCP differ by age of the woman? Yes, definitely. Now, according to the latest research, a study of more than 100,000 women suggests that the increased breast cancer risk associated with OCPs is greatest among women aged 45 and over who are still using the pill. This group of women was nearly 1.5 times as likely to get a breast cancer as a woman who had never used the pill. Okay, and one more very significant that if there is a family history, of breast cancer, please do not use the OCP. There's a definite no. Do not use any kind of OCP if there is a family history of breast cancer. Okay, so this was contraceptive pills. Another important issue which is now coming up, that is the third issue, breast implants. There has been a gradual increase in the number of women undergoing breast augmentation, that is breast implant surgery, and now the number of women all over the world with implants is quite significant, and it is expected that with more and more modalities available, the cost factor coming down, and more ladies becoming conscious about their breasts, this is going to further increase in the future. See, breast implants have not been linked with an increased risk of the most common types of breast cancer, that is ER, PR, HER2 and all positive. However, they have been linked to a rare type of lymphoma. It's type of a blood cancer, lymphoma, and that is a non-Hodgkin's lymphoma. Non-Hodgkin's type of, again I said, a type of lymphoma, Hodgkin's lymphoma and non-Hodgkin's lymphoma. So breast implants are associated not with most common types of breast cancer, but are associated with a lymphoma and a non-Hodgkin's lymphoma called breast implant associated anaplastic large cell lymphoma, that is BIA ALCL. Okay, which can form in the scar tissue around the implant. This lymphoma appears to have more often in women who have implants with textured, that is rough surfaces rather than smooth surfaces. So if you have undergone breast implant surgery, please check what kind of an implant has been placed, and if it is textured, that is rough surface implant, please be more cautious, get yourself evaluated. Now, if BIA ALCL does occur after an implant, it can show up as a lump or a collection of fluid or swelling or pain near the implant, or as a change in women's breast size or shape. Okay, so this is specifically for those who have undergone a breast implant surgery, and those who are planning in future, please be careful. Do not use a textured, that is rough surfaced breast implant. So today I have covered the role of alcohol, smoking, oral contraceptives and breast implants. Still a lot of factors are there which increase the risk of breast cancer, which I will discuss in my next talk.